for 2020. We are very excited to round out the year with such an eminent guest and to discuss issues about decision making in pandemics and in crisis and leadership throughout the 2020 COVID-19 pandemic so far. My name is Alexandra Phelan, and today in the event we will have we'll introduce our esteemed presenter, and we will have options for Q&A. If you could please enter questions that you may have for the discussion into the chat, and we will look forward to having that broader long discussion with you after today's presentation. It's my privilege now to introduce one of our Centre Research Associates, Yasser Omar, to present today's speaker. Yasser.
Hello, everyone. Good morning and good afternoon for people who are joining us from Egypt. It's my honor to introduce Dr. Maher Rabat. Professor Dr. Maher Rabat is a former Minister of Health and Population of Egypt, Professor of Public Health at Cairo University, and currently she's working as the Executive Director of the Middle East and North Africa Health Policy Forum. In March 2020, she has been appointed at the World Health Organization Special Envoy on COVID-19. Through her academic and technical work, she has accumulated more than 30 years of strategic leadership, policy, academic advocacy, and operational expertise, working closely with national, regional, and international organizations as a public health expert on a wide range of health issues and public health priorities in various contexts, such as deprived areas and among vulnerable groups. She has extensive experience in conducting system-wide assessments and reform in response to emerging needs, and has worked on strengthening health systems responses to emerging needs and human development in different regions, particularly Middle East, lower income countries, through evidence-based policy, knowledge, and exchange networking. Dr. Maher Rabat is probably one of the most influential people, public health people, not just in Egypt or Emerald, and maybe around the world. And we are so happy to have her here at Center for Health, for Global Health Science and Security at Georgetown University. Back to you, Dr. Maher.
Well, thank you very much for the introductions, and thank you for inviting me. I'm really very happy to be with you, and good morning and good afternoon as well. And it is a great pleasure to be with you today addressing leadership during pandemics. And I'm really flattered to be the last one in the series of your really seminars. So hopefully we can get through this last seminar with good results as well, and for discussion points that would really give the feedback that we really need, and to understand better from my side and from your side as well, what does leadership entail in this emergency situations. So I'm going to address leadership during pandemics, and here I'm going to be specific for the COVID-19, the threat that has caused major disruptions in our systems and lives. It has affected health systems, economic and social disruptions, demonstrated importance of several aspects like good governance and public health, health security, and highlighted as well the weak and the fragile systems and the rigid public financial management systems that does not allow sufficient flexible reallocation, challenged current models of service delivery, and at the same time challenged other aspects of health systems and other systems, and we can enlist so many other things as well. So when I was thinking of the topic of today's meeting, I thought it should be contextualized, not only to include decisive leadership, but to include as well in how we're going to address leadership and the need for it, other types of leadership, depending on the status of the pandemic and of the outbreak, and how countries are really responding to contain this outbreak. So at the very beginning, allow me to tell you a few points about the virus. So what we know about the virus has evolved several months ago, a year ago, honestly. It is a totally new situation with a total novel virus, a challenging situation that was and still is surrounded with much uncertainty. And despite all the progress that has been achieved so far in the knowledge evidence and develop new technologies to protect against it, we are still challenged by the virus and its existence. And we all acknowledge that it is going to be with us in the foreseeable future. So there is continuous learning process as we are moving ahead, and that the whole world is going through. And we are talking leadership, but we have to acknowledge as well that the world is in a situation which challenges the exercised leadership, a situation that calls for capacities, transparency, empathy, decisiveness, resources, collective coordinated actions at all levels. So the leadership is really challenged in this situation. So thinking through different platforms is challenging as well. So you need to protect your people, you need to save lives, save the vulnerables, to save the economy, to mobilize communities, to build resilient health systems, adopt and adapt to new social norms, and you can name more. And leaders need to make decisions, to articulate policies and lead around the required and envisioned response, with massive shifts affecting all of the governments and all the societies moving along. So this is a collective action of the whole government and of the whole society, and they need to be aligned in ways, and this in itself is a challenge, and it's not easy to undertake it, particularly in an unprecedented situation. This said, I want to draw your attention to the chain of events that occurred to better understand the situation and needed leadership. So this virus, it infects a person, starts a rapid transmission cycle, kills a number of people. You need to isolate, you need to treat, and you need to stop people getting together in close contact. You need more and extra resources, and you need to protect people. You might resort to lockdowns, and you have to undertake reforms and rapid shifts to support the economic and the social disruptions, and to support community actions that are needed. And the cycle continues on unless you can stop the transmission. So we aim at stopping the transmission. And this is the difficult part. As much as we say we know it all, it's how to stop it. This transmission, the cycle, is really very challenging. So as challenging is to mobilize the communities, as challenging is to get the whole government working together in a coordinated fashion, and as challenging is to continue providing essential services and to strengthen health security, which has been found to be the weakest part of the health system and the public health system. So aiming at leaving no one behind, aiming at overcoming the inequities that have been unpacked, particularly during this pandemic. So there is a learning experience, and there are tools to use that have proven effective if they are used very quickly, promptly, smartly, collectively, and decisively to avoid further spread. And all through this, we are learning from new generated evidence. So this is a learning experience, as well as a period or a phase where you need to make the decisive policy-making decisions, closing the gap between the science and the evidence and the needed policies and decision-making that are there. It is very challenging, it's not easy. So uncertainties in policy effectiveness are there because the uncertainty continues with us as we are generating evidence and with the knowledge that we are knowing every day. So the effectiveness, the policy effectiveness are anticipated, but we know from country experiences that good results can be reached from a combination of different measures and collective interventions. So now here we're talking about collective actions. We're not talking about single separate actions, even if they are successful. We're talking collective actions that have to be introduced, have to be regulated, have to be implemented all at the same time. It's like repackaging response into one package, implementing it with smartness, with swiftness, and with authority as well. So that countries have managed the pandemic differently is expected. But COVID-19 has pushed all health systems to their limits, from the very high developed countries to the very low underdeveloped countries. And here comes the role of leadership and decisive leadership per se. that features the national responses to COVID-19, from swift, strong, proactive at best, and to the slowest ones at worst. So we have a framework of action that has to be applied, but we have to understand that every country has its context. Every country has its capacity. So we need to modify, we need to adapt what we know is working well, and we know that things work in a way that would satisfy this framework and to be contextualized to the countries. And this requires decisive leadership as well. So this means that leadership guides the response through its phases and styles, from the rapid response, crisis management, to the recovery response, the recovery management, and then the post-COVID sustained phase. So we have the three phases of any emergency or crisis that we have to use the leadership styles and the leadership effectively in order to achieve the required results. So we have the phases of the crisis management, recovery management, resilient building, and the post-recovery sustained new norm. And this is the new norm that we're talking about. The new norm is never going back to the before the pre-pandemic. The new norm is a post-pandemic sustained action that needs to be institutionalized, and that we need everyone to be aligned to perform. There is no business as usual. And this is our new norm that we should be achieving and aspiring in the coming time. So decisive leaders have to react fast amid all this uncertainty. They have to address all types of pressures, calling for decisive, determinant, empathetic leadership. And at the same time, they have to broaden and expand their perspective. The perspective should be expanded to the limit or of incorporating all of the challenges and all of the needed shifts that needs to be undertaken in order to support the containment, in order to support the development, and in order to support the vulnerabilities and the social disruptions that are anticipated. And these perspectives should be broadened to allow for a newer vision. We have to have a newer vision and oversight of doing business, developing constructive, collaborative, and intersectoral coordination, while prioritizing health, prioritizing public health, prioritizing health workforce, and prioritizing all the actions and interventions that would support building back or building forward better. As we said, we need to build forward better in a resilient way and in aspects that would support future response, not only to the COVID, but to any other emergencies that are anticipated. And at the same time, we need to realize that much of the work in different contexts, they are different. So we need to consider the context of the different countries as well, given the various capacities, the prior experiences, and to unpack and underscore things that work. We know that things can work from previous experiences in similar pandemics, from previous experiences in fragile contexts, from different experience and prior experience. So we have to build on the assets and on the opportunities that are there, and to find entry points to complement this framework of action that is needed in order to contain the outbreak or the pandemic. What is there with the virus is that it finds out all the weak points in the response, and it flares and leads to surges. So this is how the virus beats all the response and all the efforts and actions. That is why actions should be collectively implemented. We should not give the virus a space in order to flourish and to thrive. So effective control of transmission and response, strong leadership, as I previously said, and decisive leadership must be able to close the gap between science and policy. So we always make decisions, or we see decisions made sometimes based on, because of the swiftness of the decisions that needs to be made with sometimes evidence, sometimes with no evidence. So they have to be made in a way, but as well, we should consider closing the gap between science and policy, and to, in a way, make the policy and decision making dependent on the technical part and as well on the political part and the policy part. And we need to address the urgent needs that needs to predict, to communicate, to modify, to allocate. So many things that they have to be done. And this requires decisive and adaptive leadership at the same time. So with a new vision, with a new oversight. We now understand that different modalities of leadership and decisive leadership are needed due to the emergence of new evidence, the continuous upgrading of our understanding due to the changing of the epidemiological situations. And this requires a framework, as I said before, which requires policies and decisions to make the necessary changes of prioritization. And as I said, these are collective judgments and decisions. So what is needed is that we need to collectively all the time step back, assess, reassess, reevaluate, and see what needs to be changed. And this is the decisive collective leadership as well that is needed in order to keep the pace of the changes and at the same time achieve the results and achieve the outcomes that we are seeking in the outbreak. So, however, we know that many countries have succeeded in doing so. So we have many of the European countries, and we know the Asian countries. We have Singapore, we have some other Asian countries, Germany, Austria, New Zealand. So we have successful examples. And we have from the MENA region as well successful examples of countries that were able to use the decisive leadership in order to contain the transmission of the virus and to protect the vulnerable people as well. So we've seen what Saudi Arabia has undertaken even before the appearance of cases, when they stopped the prayers and when they stopped the pilgrims and they started exercising their experience in the gatherings, the mass gatherings. So they were successful even when they proceeded with the pilgrims and the group and the mass gathering to protect the people, building on their past experience of similar situations. So as well, we know furthermore relative to the severity of the outbreak, we know that countries like countries in Africa, they had the privilege of foreseeing what is happening in other regions. So sometimes countries or regions, when they experienced the outbreak and the pandemic, they had this time in order to prepare and to collectively build on their experiences and strengthen their resources in order to be able to face this outcome. However, with discrepancy, we always know that it depends on the capacities, readiness, and the support and the global support that is given to the countries as well. So as we're moving ahead, we know that there are several features of decisive leaderships. And I have modified those features from a paper that is published in The Lancet about decisive leadership for a successful COVID-19 response, a necessity, not an option. And with the features of decisive leadership, there are several points that are really essential and important if we are talking acceptable, proper leadership. So it's the rapid response. We need strict, rapid response of the whole government and the whole society. The WHO keeps repeating this. It's a whole government, whole of society approach. And this is the coordinated collective actions that are needed to proceed in an emergency and in this pandemic situation. So we have to lead better. To lead better outcomes and rapid containment of transmission. And as I mentioned, Saudi Arabia introduced some social distancing measures even before the country had any confirmed cases of the virus. And a decisive leader recognizes that no decision or a delayed response may lead to a worse outcome. And that is why the speed of the government response is really important. And we have seen countries and responses and outcomes of countries that have delayed the response for some time, and the surge and the massive disruption that affected health, affected the economy and the social patterns in those countries. So what is needed as well with the rapid response it's the good coordination. And as I want to mention here that with the rapid response, sometimes the response is not based on evidence, but it has to be built on intuition and as much as possible on the experiences and from learning from what is really happening around us on the global level. And we need to be, in a way, very subjective, very objective in utilizing the guidelines and the tools that are being advocated for and have been formulated from the WHO and other international organizations. I mean, we need to have, so the rapid response should include as well this utilization of the tools that have proven to be successful. And as well, the rapid response should be there when new evidence arises. We need to be as rapid as the evidence arises. We need to be there when as rapid as the changes occur in the epidemiology, in the non-response, in the non-alignment, for the policies and decisions to be undertaken promptly, swiftly, and strongly as well. We need good coordination for a decisive leadership, and good coordination and effective leadership requires good national coordination, whether at the central level and at the sub-national decentralized levels as well, with the whole of government, all of society approaches. And to do this, we need to think beyond the specific interventions towards a whole system approach. So we need all intersectoral, multi-sectoral, all stakeholders, they have to be there on the table when decisions are made, when roles are described, when resources are allocated, and when accountability is displayed. We need everyone to be there in order to think beyond the intervention towards a whole system, a whole framework approach at all levels, while understanding the capacities and the contexts which are country specific. And we have seen what has happened in the Southeast Asian countries, which learned from the SARS epidemic how to mobilize all of, to coordinate all the interventions, all the stakeholders into a whole system approach. So another thing which is really important is to strengthen and implementing evidence-based public health measures and foresight. And this pandemic has unpacked the weakness in the public health, essential public health measures that have been implemented. For some reason, in the past decades, there have been a shift towards more medicalization and moving away from the essential public health measures and investing in essential public health measures. And this has been unpacked in this pandemic, and it has as well made governments realize the importance of the investment in essential public health measures as a priority issues, and even in the newer vision and the foresight. So the national leaders have been called to commit to evidence-based decision-making and public health strategies, including stay-at-home measures, scaled-up testing, and this also includes the capability to harness and leverage the constant change in the light of the outbreak. Another thing that here, when we're talking about investing in public health, we have to give high priority to the high quality data, because we cannot make decisions without having the appropriate data, timely data, reliable data. It's something which goes without saying, but here we don't want to say it, we want to have it. We want to have the systems that would support high quality data generation and the data sharing and data interpretation to support the decisions that could be taken as well. So now we move to another thing, and this is the one of the most important issues for leadership and decisive leadership. It is the communication, the transparency, the social accountability, and building of the trust. So you cannot move to lead, to align, to mobilize without doing this communication in a more transparent, timely way, and keeping everyone on board of things that are happening on the ground. We have to be very truthful to the circumstances, to the capacities, to what is needed, and to the decisions that are going to be made. We have to be very transparent about not only the situation, but we have to encourage and to mobilize stakeholders to align as one group into the collective actions. So everyone has a role to play, and we have to do it all, and we have to do it right, in the correct manner. And this is really very important. So meeting people where they are, we need to reach out to people. We need to change the communication narrative, to reach out to them. And it's not only enough to disseminate knowledge. We need the practical, effective communication that helps communities to build their resilience and as well to change their behaviors and practices. And this is really very important. We need to empower the communities and to adhere to the measures by individuals, by families, by communities, and to support the social accountability and the social responsibility as well. So as I mentioned, we need to disseminate truthful information while remaining adaptive to any changes and generated results as we move ahead. And we've seen what has happened and is happening in New Zealand, let's say, and in Germany, and in many countries, other countries in the region. And while doing this, we need to show empathy with those who are suffering more and those who are going to be affected more by decisions that are going to be taken. We need to show this empathy, and we need to support and to change the policies that would support those vulnerable groups and to support the vulnerabilities. And this is really very important. And for a decisive leadership, definitely we need to act decisively under uncertainty, balancing the expertise and intuition. And this is part of the characteristics of decisive leadership or decisive leader. Is you're working under uncertainty. You have to balance between what you know and what you should do, and you need to balance as well between what you should do and how you should communicate it to people in order to gain their support, even if things don't turn as effectively as is supposed to occur. And as I mentioned before, transparency and accountability and showing empathy with those who are suffering more. And the benefits of transparency, you all know about them, and it is where we stand and how we communicate and how we receive results and how we transfer or transmit or communicate the results as well, which is really important. And being transparent is a way of gaining and building the trust, which is very important, moving the people and moving everyone into the right direction or foreseen right direction as we're moving ahead. Not the second, I've said so many things, and now I'm talking about when we're communicating the transparency, accountability, we have to acknowledge the uncertainty. We have to acknowledge it. Yani we know people should understand that there is an element of uncertainty, but that we are embracing the knowledge and the learning as we are moving ahead. And then comes the solidarity-driven actions, and the WHO in all, the DG in all of his speeches, he always ends by national unity and global solidarity. And in fact, decisive leadership, part of it is the solidarity-driven actions. So significance of humanity-driven solidarity actions by leaders, which have been underscored by the pandemic. So several countries have shown solidarity in many aspects of the response, as mentioned by Dr. Elmandari, the RD of the EMR region. Saudi Arabia, for example, has supported lower income countries financially. Cuba has sent doctors to help with the response in different countries. So the collaboration between countries is not only it has to be systematized and contextualized according to the global challenges and the global needs. And it is always said, no one is safe until everyone is safe. And that's why there are different platforms that have been developed in order to, in a way, guarantee, it's not like a guarantee, but to support the equitable interventions and the equitable support to countries in need, like, for example, the COVAX facility and some other platforms as well. So collaboration between countries is essential for ensuring medical supplies, for the travel restrictions, and for faster results, let's say, in pharmaceutical trials. And we've known about the Solidarity trial and the results that are happening, and other trials that are being undertaken in many parts of the world. And WHO is supporting these global partnerships through, as I mentioned, Solidarity Fund, supply, the COVAX facility, and the other accelerator, the tool accelerator. So there are different different interventions and different platforms that are being undertaken by WHO in collaboration with other international organizations and partners in order to support the solidarity part. So we need, as well as decisive leaders, or the decisive leaders and decisive leadership should embrace and envision the future. There should be embracement to a new vision, to an oversight, envisioning the future of how things will happen, how things will unpack in the future. We have tools, we have experiences, and we have a learning evidence. We have evidence that we can learn from, and we know things that work, and things that can work in a collective manner. So this is an opportunity to step ahead with a new vision and with a decisive reshaped response, with newer insights, better governance, leadership, and commitment, and firm, strong actions to bring the pandemic to an end. And not only this, but to be ready for the future emergencies. And this is part of the health security, part of the health system strengthening, and leaving no one behind, supporting universal health coverage and health security at the same time. So this is the time, this is the opportunity, and we should not leave it. So the COVID-19 has provided us with this opportunity that we should not let go without making the best benefit of it in reshaping our future, in reshaping the health systems and the health security to support all countries, support all peoples, protect the vulnerable and those who are at risk of any emergencies. So I finish here, and thank you very much. And I think we should be moving now to the Q&A if you have, or to discussion points. Over to you, yes.
Wonderful. Thank you so much, Dr. Al-Rabat. That was exceptional and really fascinating to hear your perspectives and experiences in decisive leadership. And I think the questions that we have so far tie really nicely to a number of the points that you made, whether we're talking about solidarity and the sort of decisions that, that leaders are making in the absence of cases, for example, your example of, say, in Saudi Arabia there. I'd like to start, we have a question from Dr. Teriyaki, ICRC in Egypt, asking about the role of public vaccination and the importance of public vaccination in the disease. In the region, there are obviously different vaccines that have been approved that are being rolled out in certain countries around the region. I was wondering if you might be able to comment on the sort of leadership decisions about deciding when to approve and bring a vaccine in an emergency situation like this, the sort of broader dynamics and the decisions, and really the importance in your views of the role of vaccination in the pandemic's end and what that sort of looks like in terms of the months and in years ahead.
Okay, shall I answer now? Shall I respond now to the?
Yeah, that would be wonderful. And I have a few more questions we can sort of discuss as we go.
So particularly for the vaccination, we know that in order to bring the transmission of the virus and to protect the people, we have three things actually, and it's always being discussed. It's the community immunity, it's the vaccination, and it's the developed medicines, if we can say so, specific medicines. So we have three things now. Now we know and although there is the surge with the second wave or with the continuous spread of infection, that many of the communities are still susceptible to infection. And this has been they knew this from the seroprevalence studies in many of the countries that have experienced surges and outbreaks before. So the community is susceptible. Well, as for the vaccination, and we know there is so much debate about the vaccines, type of vaccines. There is the COVAX facility, and there are several vaccines, I think 5 vaccines, that have applied for the emergency license EUA, so emergency utilization, and as well there are the regulatory bodies in the different countries like the FDA, like the European regulatory body, the Japanese, and those in Saudi Arabia, in Egypt. So there are regulatory bodies that should, in a way, investigate or not investigate, to study the results, to study all the data pertaining to the different types of vaccines and to give its authorization. And up till now, most of the vaccines, they have applied for this emergency licensing, and emergency licensing entails particular way of utilization and particular way of follow-up. So now we know, and we see that in England they have given this emergency authorization for the Pfizer BioNTech vaccine, and this is deploying a newer mechanism of a newer type of what you call it, Yani, a newer way or a newer type of vaccine, which is the messenger RNA. So they are trying it, and they have developed it, and in a way they are rolling it out in countries under this emergency licensing, and other countries as well. They have approved it, like in the in the USA and in other Arab countries and in other countries of the world. There are other vaccines like the Chinese vaccine, and they are still making this arrangement with the COVAX facility, but they have gained approval from other regulatory bodies. And then there is the Russian, and there is the Moderna, and other vaccines, and more vaccines to come in the pipeline. The issue here is that in order to be able to rely on vaccination to cut the cycle of transmission, you have to cover all the susceptible populations in the world. We have like 7 billion people, and the production in the nearer future of those vaccines will never come and will never be able to cover all of susceptible populations in the world. So that is why there is prioritization for those who are to be vaccinated in phases according to the priority. And the priority is to protect the most susceptible, like the health workforce people, and to protect the vulnerable groups, particularly those who are subjected to complications when they are vaccinated, like the elderly, those with non-communicable diseases. And so a priority list should be there in order to be able to phase out and to roll out until the production is able to cover the people. The COVAX facility is not only allowing and is not only licensing or investigating or studying those vaccines, but it is the facility with the partners and with the contribution of most all countries in the world are there in order to guarantee the equitable distribution of the vaccines to all countries, particularly lower income countries and those with higher vulnerability. So in a way, there is a global movement in order to support the vaccine dissemination and allowing countries to have to allow countries to have their the vaccine. The issue here is when this is going to happen. So it's said that most countries, they can expect to have the vaccine in the third quarter of next year, and it's when, and it's the quantity, and it's the how. So as much as we're saying that the mRNA, these are effective and safe, its way of preservation is sometimes thought to be not suitable for many systems. So if countries want to use the mRNA, the Pfizer mRNA, they have to be prepared. They have to prepare the system for the transportation and for the dissemination within the countries. Although Pfizer BioNTech, they have prepared this cold boxes, but still, I mean, it needs preparation. So there are other vaccines that might be more suitable, like the Moderna part, the AstraZeneca part. There are different options, and countries, they have to decide based on the risk assessment, based on their capacities, and based on the requirement of the doses of the vaccine. I hope, Teria, I answered your question.
Yeah, that's wonderful. Thank you so much.
Another issue, excuse me here, there is much debate about the safety and the effectiveness. Not a regulatory body and not the WHO will ever allow the licensing, even after emergency licensing, without making sure that the third phase trials have proven safe and effective. Okay, so we don't want to jeopardize the successes. And as much as we are hopeful for the vaccines and for its dissemination and its proper utilization, we have to realize that in the foreseeable future and for the coming time, maybe I would say whole of next year, we have to utilize the vaccine whenever available and if available, together with the public health measures that are needed, with the community measures, that we cannot rely totally on the vaccine and just neglect the other measures. They have to be brought up front, they have to be strengthened and to be used collectively, or else we're going to find that the virus is going to find the weaker points, it's going to spread, and it's going to affect people in a way that is not, that all the systems are not ready as well. So we have to keep the gains that we have, that we are really achieving, and to strengthening them, to sustain them in a resilient system together with the vaccine which is there. Because up till now, there are some missing information. Like, for example, we don't know what the second dose of the vaccine, how long the effectiveness is going to stay, how long the person is going to be protected. And not only this, we don't know. Sometimes it is said, I'm not sure about this, I'm just relating some of the things that I repeatedly hear, that it is going to, even because it's a 90-something% effective, that it is going to ameliorate the signs and symptoms. So does this mean that the cycle of transmission stops? We have to think of the way collectively, and as much as we're hopeful, we should not neglect the public health measures and the investment in the public health to build resilient systems, and for the community interventions that are needed. Put on the masks, keep the spaces, hand hygiene, respiratory etiquette, and avoiding crowded places. We have to stick to all of those measures as much as possible, even when the vaccines have been developed.
Yeah, they're really, really critical points that, I think not only in terms of the time it will take to get this rollout and to make the vaccine available to all, particularly vulnerable populations, but then enough to reach some form of herd immunity from vaccination in the population. But also, as you say, that's also dependent on these vaccines not only reducing severity of disease, but also reducing transmission. I know that the Moderna data appears to indicate there is some evidence of that, but obviously the other vaccines are still being monitored to get that data as well. But really, really critical points. And I think that ties in nicely with one of the questions asked in the chat here from Hamid Duban, asking about how trust in leadership. So you've spoken about making decisive leadership and decisions. That's also got the parallel of public's trust in the leadership. And the question here is, how should leaders prepare now for anti-vaccination behaviours? And the question asks that may even emerge among healthcare workers themselves. I'd like to also add in there, perhaps, not necessarily, strident anti-vaccination movements like we've seen around the world, particularly in developed countries, but also vaccine hesitance. So people who are uncertain, who would normally get vaccinations, but might just be hesitant. So what are some of the leadership and the decision-making that can be being done now, particularly in that gap of potential trust of government?
Well, building the trust, this is a longer term, but it aspires from what governments are really undertaking to support all the interventions that are needed to protect the people, to protect the communities. And once you have this trust, you build it along with the transparency, the accountability, and in the trust of what governments are really and leaders are really undertaking in order for the benefit of the communities and for the benefit of the people. So when we are talking about the vaccines, and we know the chaos that just appeared, those who are having the vaccine and those who are not having the vaccine, countries. So I mean, it's like a debatable situation, and here the part of communication is really important. The communication narrative and the trust in the regulatory bodies, the trust in the international, in the synthesis, the pharma itself, the synthesis of the vaccine itself. So I mean, we need to trust what is being done. We need to trust the results of the clinical trials, to trust the studies undertaken and the reports being released by WHO and by the regulatory bodies, and as well to change the communication narrative in order to provide like a synthesis of the risk assessment. So these are not compulsory. Up till now, they're not compulsory vaccines. So and even if we're talking about vaccination certificate, they are going to be used for the time being in order to follow up of those who are vaccinated, you know, in a way that would just show where they are, how they are faring for the second dose, and. So the issue here is to develop the communication narrative in a way that would lead to people thinking of the risk assessment. Everybody should, in a way, assess their risk of infection and assess the risk of the complications and how much they really need to be vaccinated. But in a way as well, we need to trust the governments, and we need to trust the process itself, that in no way any government will be in a position to harm the people. So there have always been debates about the vaccines, but particularly in countries where they have the compulsory vaccines, like in Egypt, like in many of countries, we have compulsory vaccination, and they have succeeded all through the years. We all know that at some point of time, some vaccines, they might have side effects, yes, but we have to know those side effects, how to deal with them, if there are any inclusion or exclusion criteria for people who are going to take a risk, assess the risk, and at the same time trust the process and trust the regulatory bodies and their decisions in order to protect their people. We have to trust them.
So I want to sort of pivot slightly. This does cover a little bit of COVAX and other efforts, but to ask about decisive leadership at the sort of international level, from a question from Christian Wagner. You spoke about how each government needs to respond individually to the COVID-19 pandemic. And I was wondering whether you might have some insights on what you see the important role of WHO, or how WHO supports local governments from the perspective of decisive leadership. When you have that, not necessarily a sort of top-down approach, but what role does WHO play? And similarly, that would tie into the role of leadership of other multilateral response efforts like COVAX.
So the WHO is leading globally the public health efforts for containment and for the response of the COVID-19. So it's not only by providing the guidelines, but undertaking solidarity trials, unity trials, developing the solidarity funds, supporting countries with capacity building for testing, for the labs, for supporting countries as well with the procurement issues, supporting countries with the IPP materials, and with different aspects at different platforms. And at the same time, this is at the central level or the global level, but within the regional level and within the country levels, we're going to find that it is the interpretation of the guidelines, and it is the response to the needs and to the emerging needs of countries, which might be different, and building on the responses and building on the strengths that are there. The WHO, the country offices are really there in order order to strategize the guidelines and to strategize the needs into prioritization, which could be supported by WHO or by other international organizations, and to support the decision making given the strategic direction, and at the same time building on what is there, learning from the experiences. So it's not only that the guidelines are there, but we need them to be operational in order to be able to be utilized by the different countries in the different, and this is where the decisive leadership comes. Decisive leaderships on part of the global level, regional level, and on the country level. And this is and the solidarity part, the solidarity and unity part is really very important as well. And it has been undertaken successfully, although with the limited resources as well, on part of the WHO and the international organizations like the Food World Program, like the UNHCR and humanitarians. So there are different contexts that need to be contextualized in order to support. And this has been undertaken collectively with a multilateral support, or with individually by the WHO, all within the government response itself. So there are different aspects at different levels and different support. And even the R&D, not only for the COVAX facility, but it's for the tools itself, the accelerator tool for the development of for medicines, for the development of tests, and for capacity building, so that this is a collective, broader package of supporting interventions that are being given and delivered periodically as the evidence appear in all countries and for all countries with no discrimination, and in support more to the needy, the fragile, those with fragile contexts, and in lower and middle income countries. Thank you, Doben, for the question.
So I want to then build on a couple of the other questions that we have here. As a former health minister in Egypt and a leader, a global leader, and also a leader in the region, one of the audiences asked about, as a woman in the Middle East region, can you tell us about how you've managed to overcome different barriers towards becoming a minister and a subsequent global health expert? And, I want to build on the fact that we've noticed that there was a recent analysis done that looked at lack of representation on decision-making and in leadership decision-making globally as a symptom of a broken system where governments are not inclusive of gender. So I was wondering if you could reflect on sort of both aspects, your own experiences as a leader, but also on how we've seen leadership and response in this crisis.
Well, we've seen it, and it has been repeatedly mentioned that women leaders, they have led very successfully due to different aspects and due to different oversight and due to different decisive leadership actions, and they have been successful as well. Honestly, for me, Maha, I don't like to look at leadership part with a gender perspective. I want a leader, whether a man or a lady, to be there to support the process. But I want I want the representation to be there, because different perspectives are really important to come on board and on the table in order, what I mean? You have to get the gender perspective into view of the interventions or the actions that are needed. So you need to have this representation, and you need as well to see forward through how to take this gender perspective forward. It's really important. Being a lady minister, when I was a minister, I didn't think of myself as a woman or a man. I thought myself as a public health professional coming into position. Okay, definitely being the first lady minister in the Minister of Health was like, wow, it's a wow, you know what I mean? I made it, and we all made it. So I want to tell you that whoever made the decision was a man to bring me on board. So I mean, this is like a change of perspective of the importance of women, of the capability of women, and how they should come with their own perspective and their gender perspective into position. I mean, the gender perspective is really important in the COVID-19, because what we understand and what we see from the data and from the results, that women are markedly affected by the COVID-19, not only in terms of the infection, but in terms of the social repercussions, on the economic repercussions, on the violence part, on, you know, so many things. So women are at a disadvantage in this COVID outbreak, and in the response as well. So if we're talking equities and inequities, women should come as a priority in whatever interventions are directed to the most vulnerable groups. I would call them vulnerable, being in a situation that makes them more at risk of infection, more at risk of complications that might happen.
Wonderful, thank you so much. As we reach the top of the hour, I think this has been it has been a real privilege, Dr. Maha, to hear your perspectives on decisive leadership. And I think as countries around the world go into a holiday season, or go into in the Northern Hemisphere into winter, and then we also see countries in the Southern Hemisphere with outbreaks re-emerging, the role of decisive leadership is a constant. It's not just something that occurred at the beginning of the pandemic, but is something that's constantly needed. And I think reflecting on your thoughts today have been incredibly helpful, incredibly informative, and I think is a wonderful way to close out our 2020 Global Health Science and Security Seminar Series. So Dr. Maha Rabat, thank you so much for coming today. To the participants, thank you so much for your questions. This recording will be available on YouTube, and we'll share the link through our Twitter account at the Center for Global Health Science and Security. Have a safe and happy next few months ahead, everyone, and we look forward to seeing you in